I'm Dr. Bhavna Mittal, and today I will be discussing about 5 common myths in IVF. But before we proceed, I will take you through the briefs of the IVF procedure. IVF is a procedure of assisted reproductive technology. In this procedure, the egg of the woman and the sperm of the husband is fused artificially in the lab to form the embryos. These embryos are then transferred inside the womb, and if it implants, it leads to a healthy pregnancy. It is a common myth in IVF that in IVF, the egg and sperm of other people are used for treatment. Actually speaking, in IVF, the woman is given injections to stimulate her ovaries, and then a procedure called ovum pickup is done to take out the eggs from her body. These eggs are then fused artificially in the lab with the sperm of the husband, a healthy embryo. Then you are, before the treatment, told by the doctor to use donor gametes and appropriate consents are taken. So without your permission or without the need, donor egg or sperm are not used in this treatment, and the treatment is done with your own gametes, your own eggs and sperms. It's a common question which people ask, that whether the children born out of IVF are normal babies. Yes, of course, they are very much normal babies. In fact, the first born IVF baby, Louis Brown, is now 42-43 years old, and she's healthy, she's had her own childbirth, and thereafter we have studies of millions of babies who've been born through IVF and are leading a completely healthy, normal life. Actually, there is no such confirmation that IVF pregnancy results in twin pregnancy or multiple pregnancy. Sometimes there is a higher chance of multiple pregnancy in IVF because multiple embryos are transferred. But if you are keen on a single pregnancy, you can discuss with your doctor to transfer your single healthy blastocyst, and then the chances of twinning or multiple pregnancy will be minimized. It's a common myth in IVF that during the treatment you have to be on bed rest for 9 months. Actually speaking, once you conceive, you can follow your normal routine, your normal life day-to-day activities. Of course, you have to avoid very heavy exertion. Other specific instructions can be given to you by the doctor depending on your other medical conditions like your age, presence of medical complications, or any diseases like fibroids, or in case of multiple pregnancy. People usually think that IVF pregnancy results in a cesarean section. Actually, it's a big myth. It all depends on your and the condition of the baby. Even IVF pregnancies can deliver normally very well, and if there is any complication, then only cesarean delivery is required. Here I have discussed few common myths about IVF. If you have any other queries which you would like me to solve, please contact me on my contact details below. Have a good day. Thank you.